Hey everyone, you might have experienced sometimes that a multi-joint muscle is creating hindrance in the complete range of motion at a particular joint, or sometimes it creates weakness in providing complete tension or complete force at a particular joint whenever a multi-joint muscle is concerned. So today we are going to deal with the concept of active and passive insufficiency which give rise to these two situations. So this is Ishant Kumar Arora. Welcome to PhyX Pain Solution. Just now hold your screens. After explaining the whole concept of active and passive insufficiency, I am going to provide a great trick which will help you to apply this concept in your biomechanical studies and in musculoskeletal system. So before starting, you must be clear with the two terms, that is active and the term passive. Whenever active term is concerned, that means in biomechanics that we are performing something by our own will or by using our muscular force. Whereas the term passive implies when someone else is helping you to perform a movement or assisting you in a movement, that is known as passive movement. So as far as active insufficiency is concerned, it is always related to the concentric contraction or the shortening contraction in which the origin and insertion come towards each other. So there is a shortening of contraction. Whereas when we talk about the passive insufficiency, there will be the lengthening contraction, or we can say that muscle will separate out as occur in stretching. So keeping these two things in mind, now I am going to expand the concept with the active insufficiency. What does active insufficiency means? Active insufficiency just simple means that whenever a multiple joint muscle means a muscle crossing two or three joints, whenever a muscle contract at a multiple joint, and if we perform all the movement the joint crossed by that muscle, if it act on all the joints, then at any particular level it will create some weakness or decrease in tension due to decrease in optimal length of the muscle. I will illustrate this concept with an example that how it occurs. Suppose I have my flexors of my forearm. So what does they cross? They cross the wrist joint, metacarpophalangeal joint, interphalangeal joint, etc. So it is a multi-joint muscle. It is crossing two and three joints. So it can also function in making fist. It can also function in doing flexion at the wrist joint. Suppose I am contracting my muscle in order to produce contraction or movement at all the joints, like flexion at the interphalangeal joint and flexion at the wrist joint. So muscle have to work at all the joints. So this situation create an insufficiency or inability of a muscle to provide the desired strength as it provided earlier. So we can see also with an illustration that you do one thing: hold a pen in your fist in the neutral position and try to pull it with with your another hand. The strength and the hold of your fist is more in this position. Now what you have to do, just flex your wrist. Now you can see that if you hold the pen in your hand, now you can see that the strength of the fist is now decreased due to the insufficiency created by the decrease in optimal length of the muscle. This concept is defined as active insufficiency. Whenever we contract a multiple joint muscle at a particular level, it will give hindrance or there will be a decrease in the force of muscle contraction when we perform an active contraction simultaneously at a different joint levels. So this can also occur whenever we are talking about the hamstring muscle, that is also a multi-joint muscle, or a rectus femoris muscle, and these two concepts only applies to the multiple joint muscle, either crossing two joint or three joint muscle. And secondly, we are going to talk about the passive insufficiency. As a term passive, we have explained it earlier. What happened in passive? It will always be in consideration with the lengthening of the muscle fiber or lengthening of the muscle. So we can relate it with the stretching procedure. Suppose I am doing this flexion at my wrist. You can see the range of motion at this level is 90 degree. Suppose now I am flexing my wrist and interphalangeal joint both simultaneously at this joint level. So you can see the range of motion at the flexion of the wrist is decreased now. It is less than 90 degrees now because of the insufficiency of the extensor muscles. Because of the insufficiency of the extensor muscles, they are not allowing it to flex completely because of its lengthened position. It is not in pathological condition, it is in physiology due to passive insufficiency. As I have earlier mentioned that passive insufficiency is considered with the lengthening of the muscle. As I am flexing this, so muscle get lengthened here like in stretching procedure. Now I flexed it. You can see that it is not giving the 90 degree full flexion at the wrist joint. So and if I open my fist and giving it full length, then I flex, then you can see that full 90 degree flexion. So this explains the concept of passive insufficiency. And suppose now we are going to give the trick that how to apply and how to think in just a second that which muscle will going to give the active insufficiency or which is going to passive insufficiency. For that you must well aware with the two terms, the agonist and the antagonist. Agonists are the muscle group which perform a particular movement. Suppose I am flexing my elbow, at this time my brachialis and my bicep brachii acting as agonist, whereas the posterior compartment muscle or the muscle which is moving against this action is known as antagonist. So whenever we are applying this concept of active and passive insufficiency on, it will always apply on a multi-joint muscle, and if we are talking about an agonist, then it will always be due to active insufficiency, and if we are talking about the antagonist, then it will always be creating the passive insufficiency. So this is the trick. Now there is one question for you. Suppose I want to perform flexion at my knee joint and extension at my hip joint. So which two muscles will perform the active and passive insufficiency? So stay tuned, stay healthy, share this video with your friends and spread the knowledge, because at last it you versus you and the competition